Welcome, everyone. Today's topic is adrenal insufficiency, an important yet often overlooked disease. It's not always easy to recognize, and many patients go undiagnosed for years, suffering from fatigue, low blood pressure, and vague symptoms before anyone realizes what's really happening. In this video, we'll explain the symptoms, presentations, diagnosis, and treatment of adrenal insufficiency, step by step, so you can understand how this small gland plays a huge role in your body's balance. In the next video, we'll go deeper into the same topic, exploring adrenal emergencies and how to manage your treatment before surgeries, dental work, and during pregnancy. These are very important subjects, and each one deserves its own time and attention. So stay tuned. Let's begin the journey to understand the hormone that follows the sun.
Cortisol, the hormone that follows the sun. Every day, with the rising of the sun, the human body begins its journey anew. A small hormone called cortisol is the first to awaken. It rises quietly, as if walking alongside the light. It's the hormone that alerts the body and sets the rhythm between activity and rest, between the movement of day and the calm of night. But when the adrenal glands weaken and cortisol drops, this rhythm breaks down. You feel unusual fatigue, your blood pressure drops, and your energy fades for no clear reason. The adrenal glands are very small. Each weighs about 5 grams, but their influence on the body is immense. There's one adrenal gland above each kidney, and each has an outer layer and an inner core, like a mango fruit with soft pulp and a central seed. The pulp, or outer layer, the cortex, produces the body's essential hormones: cortisol for energy and stress response, aldosterone for salt balance and blood pressure, and androgens, which in women influence mood, libido, hair, and vitality. The seed, or inner core, the medulla, produces adrenaline, the emergency hormone that prepares the body for danger, increases heart rate and breathing, and gets you ready for a fight or flight moment.
The chain of command, the hypothalamic pituitary adrenal HPA axis. Imagine your body as a 24-hour factory that never stops. At the top floor sits the general manager, the hypothalamus, the main control and monitoring center of the body. It receives signals from everywhere, from the brain, from the organs, and even from emotions. Once it senses stress or danger, it sends a small signal called CRH, or corticotropin-releasing hormone, to the operations manager, the pituitary gland. The pituitary receives the message and writes a new command called ACTH, or adrenocorticotropic hormone, which it sends immediately to the production plant, the adrenal glands. The workers start right away, producing the essential product, cortisol. Cortisol then spreads throughout the body, stimulating organs, boosting heart rate, and preparing the body for any stress or effort. But if the general manager, the hypothalamus, stops sending orders, or if the operations manager, the pituitary, falls asleep, the workers stop, and the factory shuts down. That's what happens in secondary or tertiary adrenal insufficiency. If the factory itself, the adrenal glands, are damaged, then even if the orders arrive, the production stops. That's primary adrenal insufficiency, known as Addison's disease.
Symptoms develop gradually over months. Persistent fatigue, general weakness, dizziness, low blood pressure, and an unusual craving for salt. The skin may become darker, especially around the mouth, joints, and armpits. In women, menstrual cycles may become irregular or stop. Sadly, many people live for years without a clear diagnosis, being treated for scattered symptoms until someone finally thinks of the adrenal glands. If diagnosis is delayed and the glands keep failing, a serious condition may appear, the adrenal crisis.
An adrenal crisis happens when the body faces severe stress or infection, and cortisol isn't sufficient to protect it. The patient becomes extremely weak, blood pressure drops suddenly, the pulse weakens, and they may feel dizzy or even lose consciousness. It's a medical emergency that needs urgent treatment and immediate transfer to the nearest hospital, because any delay can be life-threatening. Quick diagnosis and prompt hydrocortisone injection can save the patient's life and restore balance.
Diagnosis begins with a simple morning blood test, serum cortisol, done between 7 and 9 a.m., the time when cortisol should normally peak. If the result is low, we perform a confirmation test, the ACTH stimulation test. In this test, we inject a substance called synacthin, cosyntropin, a synthetic form similar to the natural ACTH hormone that stimulates the adrenal gland. Cortisol is then measured after 30 and 60 minutes. If levels don't rise adequately, it means the adrenal glands aren't responding properly. Before the test, we assess sleep pattern, because lack of sleep or staying up late can affect the result. The sample should be taken after a normal night's sleep for accurate evaluation. We also check for factors that may alter results, such as estrogen use from contraceptive pills or hormone therapy, which may falsely elevate total cortisol. We must also confirm whether the patient is taking any form of steroids, injections, creams, inhalers, or eye drops, since these can suppress adrenal function and distort test results. Electrolytes such as sodium, potassium, aldosterone, and renin are also reviewed to evaluate salt balance and blood pressure control. Finally, we integrate lab data, symptoms, and medical history to determine the exact type of insufficiency, primary, secondary, or tertiary.
Treatment replaces the hormones the body can no longer produce. We use hydrocortisone, identical to natural cortisol. The average total daily dose ranges from 15 to 25 milligrams, divided according to the body's natural rhythm. 10 milligrams at 7 a.m., right after waking up, 5 milligrams between 12 and 2 p.m., an optional 2.5 to 5 milligrams between 4 and 6 p.m. if needed. The goal is to maintain stable energy throughout the day, without excess causing side effects, and without deficiency causing fatigue or dizziness. Avoid any dose after 6 p.m. to prevent sleep disturbance and maintain normal rhythm. In primary adrenal insufficiency, we also add fludrocortisone, Florinef, to maintain blood pressure and electrolyte balance. Patients should drink enough water and include about 1 teaspoon of salt daily, especially in hot weather or with heavy sweating. Doses may change during illness, stress, or physical exertion, so regular follow-up with the physician is essential to stay balanced. Sometimes, other steroids may be used, prednisone or dexamethasone. These last longer than hydrocortisone, so they may be taken once daily, but must be carefully adjusted to avoid over-replacement. Hydrocortisone remains preferred because it mimics the body's natural rhythm, allowing better control of energy and activity.
Follow-up every 3 to 6 months is very important to review blood pressure, energy, and sleep. Take calcium and vitamin D, maintain a balanced, healthy diet, and engage in daily light exercise to protect bone and muscle. Always keep extra hydrocortisone tablets so you can double the dose during stress or illness, and never wait until your last pill before refilling.
Androgen replacement in women. DHEA. In some women, adrenal insufficiency reduces not only cortisol, but also the hormones of vitality and mood, like DHEA and testosterone. These are partly produced by the adrenal glands, and when they drop, women may feel fatigue, poor concentration, or reduced libido. In such cases, doctors may prescribe DHEA supplements in doses of 25 to 50 milligrams daily to restore natural energy and emotional balance. Not all women need it, but for some, it can make a remarkable difference in mood and vitality.